Hello guys, welcome back to Clinically Clear. So today let's cover the first infectious disease, that is measles. Okay. Now any infectious disease, communicable disease, we first tell the epidemiological triad. That is the agent factor, host factor and the environmental factor. Agent factor. The causative organism of measles is paramyxovirus. It is a single-stranded RNA virus. The mode of transmission, it is a respiratory infection. So infected droplet nuclei. The period of communicability is when it can spread. So it is communicable 4 days before the onset of rash, minus 4 days, and 4 days after the onset of rash. The incubation period for different symptoms it differs. Fever appears 10 days after infection. Rash appears 14 days after infection. Fever in vaccine induced measles appears 7 days after infection. So this is about incubation period. Secondary attack rate. What is secondary attack rate? It is basically telling you how communicable it is to the close contacts. So I have a measles case. To the close contacts surrounding me, how likely are they to get measles? That tells you the secondary attack rate, and it is quite high for measles, 80%. That says it is very communicable, very infectious. Then coming to the source or the reservoir. For measles, you only have clinical cases and only human clinical cases, no animal reservoir, no subclinical cases, no asymptomatic cases, nothing. Clinical symptomatic cases, they are the source, they are the reservoir. So therefore there is no iceberg phenomenon, no animal reservoir, no subclinical cases. These are all the agent factors. Paramyxovirus, infected droplet nuclei, minus 4 days plus 4 days period of communicability from the rash. Incubation period 10 days for fever, 14 days for rash, and 7 days for vaccine induced measles. Secondary attack rate is high, and source or reservoir is human clinical cases. Environment, basically it is a respiratory infection, so more during winter. Host factors, if you take into account, age. In developing countries, measles is seen in the age group between 6 months to 3 years. In developed countries, after 5 years. That is important. This is an important thing. And malnutrition meaning weakened immunity. Weakened immunity meaning higher risk of getting measles. And after a measles attack, immunity is for lifelong. That is basically second attack is very rare. Secondary attack rate is high. That is communicability to close contacts. But second attack of measles after the first attack is rare because of lifelong immunity. Then coming to the clinical features, basically you have infection till 10 days incubation period. Then comes the prodromal stage from day 10 to day 14. Day 10 there is onset of fever. In this prodromal stage, basically you have a flu-like illness. You will have cold, coryza, myalgia, arthralgia, and you can have other systemic features due to viral infections such as diarrhea may be present or not present. And very important, in prodromal stage you will have Koplik spots, that is bluish white spots in the buccal mucosa around the first and the second molar, and this Koplik spot is pathognomic of measles. That is, nowhere else will you see Koplik spots, only in measles. Then coming to eruptive stage. Eruptive stage is basically from day 14. Day 14, there is an onset of rash, and it starts behind the ears. The rash always starts behind the ear. A red maculopapular rash that starts behind the ear. It then progresses to the whole face and the neck, and eventually, after 2 to 3 days, the whole body, and then 4 to 5 days, it disappears. So that rash follows a typical progression in measles, and the eruptive stage is all about the rash. Once the rash disappears, we go on to the post-measles stage. And this post-measles stage is what is very dangerous, very important, because in this post-measles stage, you have peak viral shedding. First of all, that is peak viral shedding, most communicability, and chronic illnesses, pneumonia, diarrhea, all that kind of other complications are seen in post-measles stage. Weight loss, fatigue, failure to thrive. Basically, Post measles, after the measles attack, child becomes very weak, low immunity, weight loss, fatigue, other secondary attacks, secondary infections. That's the worst part. Post measles stage. So prodromal stage, complex spots, fever and flu-like symptoms. Eruptive stage about the rash, and post measles stage is for the chronic illnesses. Diagnosis: RNA virus or RT-PCR. Treatment is supportive treatment, no need of antibiotics. It's a viral infection, right? And vitamin A. Complications: respiratory system complication. The most common complications of measles is otitis media. That's the most common complication. The most dangerous complication, most fatal complication is pneumonia. TB also, latent TB. If the child had latent TB, post measles stage, because of weakened immunity, it can flare up. TB can happen. But the most common complication of measles is otitis media, most fatal is pneumonia. And the most commonly associated systemic symptom is diarrhea. GI, diarrhea due to gastroenteritis. That's the most common associated system. CNS manifestations like encephalitis, subacute sclerosing panencephalitis, encephalitis, CNS complications. And in pregnancy, if the pregnant woman gets measles, abortion. It can lead to abortion. So these are complications. Most common otitis media, most fatal pneumonia, TB also. Then you have diarrhea, which is the most common associated symptom. CNS, you have subacute sclerosing panencephalitis and encephalitis. Pregnancy, it can lead to abortion. Now, prevention of measles, WHO has given a 3-tier elimination strategy. First, we do catch-up immunization. First, we catch up. How do we catch up? By immunizing all children between the age group of 9 months and 15 years, irrespective of previous history of immunization. Doesn't matter. We are conducting a nationwide vaccination program where all children between the age of 9 months to 15 years will receive the vaccine irrespective of previous history of immunization. That is catching up. Then we need to, once we reach a certain level, we need to keep that level, right? So keep up immunization. That is routine vaccination services to whoever comes to the hospital, to the clinic, all that. That is keep up immunization. Follow up immunization. Not everyone comes to get immunized. So once again, you will do nationwide immunization camps, vaccination camps, where you will again target cyclically every 3 to 5 years. You will do a nationwide immunization camp so that you follow up and all the target children are immunized. So that is the WHO strategy. Catch up immunization, irrespective of history, 2 doses, vaccination nationwide camp, then keep up, then follow up. The best method of prevention of measles is active immunization. That is measles vaccine. Measles vaccine is a live attenuated freeze-dried vaccine. Because it is freeze-dried, you can't just directly inject it, right? You have to prepare it by reconstituting it, by mixing it with distilled water. But once you mix it with distilled water, you have to use it within 4 hours. You can't just leave it open for 15-20 days and still continue giving from the same vial. Once you mix that live attenuated freeze-dried vaccine, you have to reconstitute it with distilled water. The strain is Inonston Zagreb strain. What is Inonston Zagreb strain? Inonston Zagreb strain is basically the name of the strain in the measles virus, name of the strain of the measles virus that is used in this measles vaccine. Storage. Measles vaccine is heat sensitive, so you have to store it under cold chain, that is 2 to 8 degrees Celsius. It is light sensitive, so it is the vials you can see it's in dark bottles. The glass is a dark glass because it is light sensitive, and heat sensitive, so cold chain. Schedule. Now, in NIS schedule, welcome back to Clinically Clear. I sincerely apologize for the abrupt ending in the previous video. I had a technical issue, so I had to get into it. I'll continue from where I left off. So, as I told you, the measles vaccine can be under the NIS schedule, National Immunization Schedule. You will give 2 doses. The first dose is given at 9 months, which has an efficacy of 85%, but the second dose given at 1.5 years, the booster dose, gives you 98% protection. Just tells you how important the second dose is. So 9 months and then 1.5 years, 2 doses. How will you give it? 0.5 ml subcutaneous upper arm. Subcutaneous injection upper arm 0.5 ml. So live attenuated vaccine which is given subcutaneously, 0.5 ml is measles vaccine or MR vaccine, whatever it is. Contraindication, think about it. Acute febrile illness. See, before I come to contraindication, I'll tell you the adverse effects. One of them is vaccine-induced measles. Vaccine-induced measles-like illness Basically, it is a febrile illness where after 7 days the patient will get fever. The child will get fever. The worst complication is toxic shock syndrome, where it is not due to the vaccine, it is because the vaccine vial is contaminated with staph aureus that leads to toxic shock syndrome. That's the worst one. So these are the two dangerous adverse effects. You can also have anaphylaxis. See, anaphylaxis is a adverse effect for every single vaccine. Okay, you can write it as an adverse effect. The contraindication is basically pregnancy. It is contraindicated. Why? Because it leads to abortion. Acute febrile illness. We don't want vaccine induced measles to again cause fever when already the patient has acute febrile illness. And live attenuated vaccines in all immunocompromised children, HIV children, it is contraindicated 100%. It is a live attenuated vaccine. Already their immunity is compromised. There's a chance that can lead to actual measles. So it is contraindicated. That is an important point. Now the uses. Of course, under national immunization schedule at 9 months you will immunize the child for measles. 9 months and 1.5 years. But not just that. Post exposure prophylaxis within 72 hours of exposure if age is more than 9 months. If a child has been exposed to a measles case, a child older than 9 months, within 72 hours you can give the vaccination as post exposure prophylaxis. That is one very important use. And another extremely important use is known as supplementary immune activity or measles zero dose vaccine. It is not a part of national immunization schedule. It is a zeroth dose. It is not the first dose. It is not the booster dose. It is an extra dose. But when do we give it? For a child aged between 6 to 9 months old, not to everyone. If there is a measles outbreak, if the child is traveling to an area which has measles outbreak, if it is a high risk children, HIV children, refugee children, homeless children, then you'll give an extra supplementary immune activity dose, an extra zeroth dose of measles vaccine to build their immunity. And it is not a part of NIS. That is, you have to leave a 4-week gap between the zeroth dose and the first dose. Let's say 8.5 month old child, measles outbreak. Then you will give this zeroth dose. Then you'll first dose according to NIS is at 9 months. But 8.5 you've given a zeroth dose. So you have to give a minimum of 4-week gap. So you'll give that first dose at 9.5 then. Understood the logic, right? So this is a separate extra dose for measles. Okay. The immunity, as I told, is lifelong. It develops 10 to 12 days. Just like after a measles attack, there won't be a second attack. For measles vaccine, also a best method of prevention because measles vaccine gives you lifelong immunity. And advice is you should not, the child should not receive any blood products for 3 to 6 months. Tuberculin skin sensitivity test should be not advised for 4 weeks. Why? Because it will give you blunted results. Pregnancy, you should advise not to plan for pregnancy for the next 4 weeks. Why? Because measles, one of the adverse effects is, one of the complications of measles is pregnancy can lead to abortion. So somehow if the vaccine leads to abortion of the pregnancy, we don't want that. So that is why these are all some advice you'll give to the patient. Now, this post-exposure prophylaxis as a use was for a child aged more than 9 months. What if the child is aged less than 9 months? Or if the vaccine is contraindicated. When is the vaccine contraindicated? Immunocompromised or immunocompromised or the pregnancy or acute febrile illness, that is when the vaccine is contraindicated, right? So in such cases, or if the child is aged less than 9 months, you will go for passive immunization where measles immunoglobulin is given at a rate of 0.25 ml per kg intramuscular. Measles immunoglobulin passive immunization 0.25 ml per kg intramuscular, whereas measles outbreak whereas measles vaccine you'll give subcutaneous. Now measles outbreak, you'll do 3 things. You'll do supplementary immune activity, that is you'll give this zeroth dose for a measles outbreak, you'll do that. Post exposure prophylaxis, that is more than 9 months measles vaccine, or if less than 9 months or vaccine contraindicated, then passive immunization. And you have to isolate the measles case for 7 days after the onset of rash. Onset of a rash behind the ear, Isolate that measles case for 7 days so that the outbreak does not get worse. Okay, that is it for measles. Now, this video I have been a bit sketchy with the explanation. I've not been that thorough with my speech, with my flow. I apologize. Thank you for watching.